And specifically, we're in front of City Hall where this legislation is coming from, and it's intended to apply to every hospital in New York City, public or private, and also to anyone who needs health care. Let's face it, that's pretty much all of us.
I had a baby less than a year ago. Then I had to go back to the ER and for services that my insurance company did not want to pay.
It's because of medical cost issues like hers that most of the New York City Council and the city workers' unions did this.
When do we want it? Now!
They held a rally calling for a city Office of Healthcare Accountability. More than that, they've written legislation calling for it, and 44 of the 51 council members, a supermajority, have signed on.
You might be charged $55,000 at Montefiore for a C-section or $17,000 at another hospital for the exact same procedure. A routine colonoscopy can cost $10,000 at one hospital, $2,000 at another. At your most vulnerable time, when you're in the hospital, you have no idea what you're about to be charged.
Councilmember Julie Menon is the main sponsor of the bill. It would create an office designed to hold down rising costs. For city employees alone, health insurance has risen from $1.6 billion 23 years ago to $6.3 billion in 2017 and is expected to rise to $11 billion this year. The proposed new office would monitor and publish costs for medical services at each different hospital in the city to help potential patients pick and choose.
That's something that should have been done a long time ago. It's outrageous, actually.
At a council hearing, city government health leaders said they favored the legislation, but a senior representative of the city's hospitals said that the oversight being proposed might conflict with federal oversight of hospitals.
It also could tarnish the reputation of a hospital that the federal government has said, yes, you are complying with our rules.
And at least one person we spoke with was concerned that the proposed change would reduce competition and therefore raise prices even more.
So, I mean, that I don't agree with.
And again, 44 of the 51 members of the City Council support this measure, and the Eric Adams administration is a backer as well. So it's likely this will go forward.